Okay, I hope I'm coming through. We can begin by review of the cases. I hope everybody enjoyed working on these cases. Oh, let me back up. I guess I don't have, yeah, I don't have the cases on my computer screen, but the first case was a 46-year-old male, and he stepped on a rusty nail with the sole of his foot several days ago. It is moderately swollen. Two, quite painful, and he describes the pain like a sharp splinter. The wound looks bluish with bruising, too, and there's no drainage. He describes his foot as being colder than normal, a 1, and finds that the wound feels better with ice packs, too. So the first thing you notice with these cases that there are numbers listed after the symptoms. And we will discuss these numbers later on in the course. But for now, the numbers refer to intensity. So a number 1 would be mild intensity, 2 is moderate, 3 is very strong or severe. So when you're taking a case history, I would encourage you to write down on a piece of paper the intensity. Usually, if someone describes or gives you a symptom without prodding, that has a higher value. So, in other words, what's wrong with you? I got a severe pain in my throat. It's killing me. That would be number 3. But if you ask them, is it better drinking warm or cold water? Then that would be something that you elicit that they don't volunteer. So that would be a lower ranking. So when a patient or a person describes their symptoms spontaneously, that has a much higher ranking. So this case clearly is a first aid case, and we need to find a remedy that fits the situation. So there are several remedies that could be considered in this case. Ledum, palastre, apis mellifica, and hypericum. The best choice is ledum. Ledum is the most common remedy for puncture wounds with suppuration. It is also useful for insect bites and stings with swelling and inflammation that follows. There is usually bruising and ecchymosis in this area, and this situation can lead to abscesses or cellulitis. And a great keynote, and as I mentioned, keynotes is something that seals the case, that confirms the case, is that the part of the body that was punctured is chilly and better cold, and they are actually worse from heat. So, in this actual case, this individual received a single dose of Ledum 30C, a single dose, and the symptoms resolved in 24 hours. So, I suspect that if he was given hypericum or apis, there would have been a mild improvement, but nothing like the dramatic improvement with Ledum. So Ledum um, was the more similar remedy. So are there questions on the first case? Anybody have questions on the first case? I'm looking for hands. Okay, Craig. Craig, you have a Question? Wait, I'm trying to unmute you. Okay, Craig, you're
Can you hear
unmuted.
me?
Yeah, I hear you great.
Okay, great. Yeah, so could I just kind of go over case number one, exactly what I did, because I wanted to find out exactly where you found and what page you found the lead-em on. What I did was I just, so in Kent's repertory, what I did was I went to the word index and back. Now page 26 of the word index, it said fret. So I went to fret, and it said to go to page 951. So from page 951, then I went to extremities, and then to pain. So then it said to go to page 1043, and then after the pain, it said fret. So then it said to go to page 1078, and then after fret, it said solo to fret, and it said page 1080, and then under that category, there's a whole bunch of different options, and one of them was splinter, and then there was a remedy for splinter. So I'm wondering where I went wrong and what pages you went to come up with your conclusion.
Well, actually, this was a
Can you
case.
hear me?
Yeah, I heard you. This was a case that you were supposed to
Okay.
use Borky because you were given
Oh,
remedies to read
okay.
about in Borky. I really don't want you to be using Kent's
Okay,
repertory.
so what I did is the wrong book?
Yeah, Kent's
Okay,
repertory
so I
is
used
very
the wrong book is
difficult.
basically what you're saying.
Yeah, and we're going to be studying Kent's repertory and how to use it in the future. But for now, the first class we just dealt
Okay.
with first aid remedies. And if you read the remedies in Boriki, um, it'll make sense. So that's
Could
probably
you
where
go
you're
over
supposed to
then,
get your
I
information.
have so I have Orky right here. Could you go over the steps that you went to in the book, the pages you went to find out that remedy?
Well, the list of remedies for the homework assignment.
Alright.
As you read through those remedies, um, you're going to find out that
Okay.
certain remedies are good for trauma, certain injuries are good for injury, and uh, reading through all the remedies, apis, hypericum, and ledum were the top three remedies for this situation.
So so I guess if it was any particular case, then if it wasn't this particular case, and if that not being the homework assignment, those first
Well,
remedies,
yeah,
if
the
I had this
cases
case,
were, yeah,
I didn't look up those.
the cases were
So what
to,
I'm wondering is, let's say it was I guess my question is, if it was anything, not, let's say it was something completely different, and I wanted to look up, let's say I didn't have those first remedies that you mentioned, and that person came in case number one, and I wanted to pull out my, my Bornickes. How would I go about then in Bornickes? How did you come about that answer? Was there a certain part like what I did through Kent's repertory, or
well,
is it completely different
I don't
based
think you
on
have the
because you?
knowledge yet. This is only our second class. And as we go on,
Okay.
by the end of these six webinars, then you'll be competent to be able to do it. But right now, it would be extremely difficult for you to go into Kent and look up these symptoms um, and come up with a remedy at this
Okay.
stage. I mean, you can play around with Kent, and it's not going to hurt you. But these cases were classic illustrations of of a remedy that I don't have the right version of Boriki, but if I read, I mean, we're starting out with just a few remedies. So let me
Okay.
go
No, I
delete
understand that.
them.
I see. I guess I asked that because, for example, my niece the other day had a really bad migraine, and I wanted to find out. I don't know what the right remedy for that is. She has migraines. I was taking a picture. The camera flash made the migraine, really quick onset. So I'm trying to figure out why I didn't learn about that. So how do I pull out my Borniquets, or can I pull out my Kents and figure out what to do, or do I have to wait a couple more months? Or I don't know. That's what I'm trying to say. Is there a way I could, kind of get an idea of what to do? Would I pull out Borniquets, and if so, what page would I go to? Or should I pull out Kents and look through the index, and then pull out pain, and then head, and then that's my questioning. That there's some things that maybe I wanted to jump the gun. Something came up, and I didn't know what the answer was. So I was wondering how to do it, how I would go about doing that.
Yeah, it's really kind of tough at this point.
And
To
okay, if that's for a later time, that's fine too.
now at the end of the
Okay.
sixth webinar, if you're still in this situation, then I haven't done my job. But I'm hoping by the end of the sixth webinar, you're going
Okay.
to be confident, to be able to treat these problems using Borky and Kent. So right now, I'm introducing you
Okay.
to
Yeah,
Kent.
I guess I'm jumping the gun. Okay.
But I have to admire you. You jump
Okay.
the gun.
I guess I wanted to. I was hoping for.
But just be aware that sometimes
I
homeopathy
wanted to see
teases
if
you.
I could put.
Sometimes homeopathy teases you. You have luck.
Okay,
You have
because
beginner's luck with the first couple of cases, and then after that it becomes tough.
okay. Yeah, because I was thinking, if I'm getting the emergency kit and something like this comes up, what would I do? Because I don't know yet. Do I need to wait for 6 months, or do I need to keep
I would
bothering
look in
you
the
and say,
emergency
can you help
kit,
me with
and
this
your
one? Can you help me
emergency
with
kit
this
has
one?
a brief description of every remedy and the keynotes for each remedy. So if you
Okay.
open up your remedy kit, each remedy then has a description, and you're going to find, certain remedies are for migraine. But, in Kent, it would be head
And
pain
would you say,
pulsating.
okay,
In Kent, it would be head pain pulsating, but there's probably over 100 remedies for that. And we're going to
yeah,
talk
that's
more
what I was
about,
always trying to figure out.
and that's why,
Okay,
there just isn't one homeopathic
okay.
remedy, um, for a migraine. It
Oops.
depends on,
Hello.
do you still hear me or did I,
Yeah,
you still
yeah,
hear me? Yeah, there just isn't one
yeah. Can you hear me?
remedy for migraine. It depends on, and you're going to learn the
Yeah, it
keys
seems
to.
like yeah, yeah. It seems like there's definitely a whole bunch of different things, and of course, um, being new to this, it's overwhelming. But I just trying to jump the gun and saying, well, maybe I might be able to help my niece by pulling out one of these books. I don't know if you said that the homework assignment we should have used Bornicke. If we used Kent, does that mean that it's more advanced, that it'd be harder for me, or Kent's not better to use and Bornicke's better to use, or you use them both, or these are
Use
the
them
things that I'm a little
both.
confused on.
Use them both, but we really haven't talked about the
But
repertory at this point, and we are going to go over to the repertory, I think, in the next
if you
class.
were so basically in Kent, if for the same homework assignment, you would have done it basically the same way and come up with the same conclusion. So you could get the same answer from Kent and Bornicke,
You
just a
could.
little different way,
Oh, definitely.
going. Okay,
In fact,
okay.
I'll show you. Let me see here. Wait.
Yeah,
Let me show you the repertization I did using Kent for that particular case.
yeah, sorry, I didn't try Bornicke's. Maybe I just didn't read the assignment correctly, but I just went directly through Kent. So now I got to figure out how I would do it through Bornicke. So
Okay, any other questions on the first case?
okay, thanks.
So for the next, you're going to be getting two cases, next week or for next month, and the key is to essentially use your notes because everything in the first lecture there was the information for you to get to select the correct remedy. So it's a combination of doing your homework, reading about the materia medica in boric, and looking over the notes, because when I do lecture on these remedies, I'm giving you the keynotes of the remedy. So if you review the notes or the PDF that I sent you on Leadum, I mean, every point here is there. Okay, while we're waiting for my homeopathic software, and I'll show you the how I got to the remedy using Kent. Okay, the rubrics. Okay, now I'm going to move on to the. Oh, and what I'd like to do is if you could send me prior to the next webinar, if you could send me your analysis, then I'd be happy to review that um, with you. You know, if you have any questions, and you know, if you get lost. Okay, let's go over the second case. MC is a 25-year-old woman. She calls in much distress due to urinary pain. Number 3, very high. This started very suddenly 4 hours ago. So the information we have, she's in much distress, severe pain, sudden. She also has a long history of urinary tract infections in the past, so this is not new. One comment I need to make on that: typically when someone has a long history of problems, that may be a more difficult acute case to treat, because a long history indicates it's more of a chronic. So just something to keep in the back of your head, because this course is dealing with acute problems, not constitutional or chronic. The pain was described, or she describes the pain in the bladder as violent and fairly constant. Pain is described as burning, number 3, and worse when she urinates. There is much tenesmus, and that means cramp. There are large clots of blood which she is passing. She is feeling quite irritable, anxious, and restless. She describes no particular causation. Okay, so I want to ask the class if anyone wants to take a stab at the remedy and why they chose the remedy. I gave you the answer to the first one. Now I want to hear from you. So I guess no one raised their hand. No one's raising their hand. Should I call on somebody? Okay, Norma raised her hand. Okay, Norma, you're unmuted. Norma? I guess Norma can't hear me. Her hand's up. You're unmuted, Norma. Oh, Debbie has her hand up. Debbie, I don't see your hand. I don't see your hand up. You're unmuted, Debbie. Debbie?
Okay, you can hear me fine?
Yeah, but you didn't have your hand up.
Yes, I can hear you.
Okay, but I'm just making a comment.
Well, according to my computer, it says my computer shows the hands up. I'm sorry.
Okay, anyway.
That keeps happening to me. I've had a number of my hands up. Okay, I got cancerous, 30 Cs, 4 hours apart, and the way I came to that was bladder inflammation, and then bladder pain with burn, and then pain in the urine, and then bladder. You know, it's very easy to answer the first gentleman's question. If you kind of look at the symptoms that are there and they're numbered, you can go through that very easily and dwindle it down. And then, of course, the number 5 I came up was urine had blood in it, And then number 6 was mind was irritable. So then you just trace your path.
Okay, and how did you use Borky or did you use Kent?
Well, I kind of went through both of them, but I was mainly using Borky.
Okay, but all the information was in the class notes. You know, the slides
Yes,
that I
that's
gave.
true, but I'm just trying to get comfortable using the books.
Mm-hmm.
Yes, I'm just trying to get comfortable using the books.
Good, good. Okay. Okay, and then Todd Wiley also, he votes for Cantharus. Are there any other thoughts? Any other remedies? Norma, you had your hand up, but I don't know if you can hear me, but I can't hear you. Maybe you could type the remedy. Oh, Norma also chose a Cantharus. Okay, so let's, if there's other comments, let me read about this. This is another example of an acute case. We're looking for a remedy useful for urinary tract infection. A remedy with the characteristic of being severe, violent, coming on suddenly with burning pains in the bladder, tenesmus, bloody clots, and irritability. Now, you can find a number of remedies that would be close. Terebinthina is a remedy. Apis, pulsatilla, Nux vomica, Cantharus, and Mercury corrosivus. They're all remedies that can fit somewhat. But when you read the description for these remedies, Cantharus stands out as being the most similar. Cantharus is one of the main urinary tract infection remedies. It's an intense remedy that comes on suddenly and violently. Typically, there's much bleeding, tenesmus, and burning. And in the actual case, the person took 2 doses of Cantharus, and within 8 hours, the symptoms had completely resolved with no recurrence. So this was a really dramatic case. Now, if you had chosen one of the other remedies, there would have been some improvement, but not this dramatic change. So this again illustrates, the power of homeopathy when you select the right remedy. Now, Debbie, I see your hand up again. Did you have another comment? Debbie, your hand's up.
No.
Okay, there must be a lag. There must be something wrong with your computer because now your hand came up. So if you could unclick your hand.
My hand shows that it's down.
Yeah, I'm seeing that it's up. Oh, now it's down. Now it's up. Okay, I'm going to pull up, open a patient file, let's see, case number 1. Here, I'm going to show you the, let's see, where is it? Case 1. Oh, I'm not able to do this. Trying to get the clipboard for case 1. Oh, let's see. Repertories. Oh, my apologies. I'm just trying to get case 1 that I pulled up the symptoms, but I'm not. Okay, well, I'll have to work on that. So hopefully next time I'll show you the actual the repertory from Kent. Okay, so right now, the advice I give you for your next 2 homework assignments for next month, I would encourage you, number 1, to review the notes. I'm going to be sending you a PDF of all the slides, which have the keynotes of each remedy. And for now, looking at the keynotes are probably going to be the best way to determine the remedy. Second, I would read about the remedies in Borgi. Lastly, I would look at Kent. Kent tends to be very confusing and can be overwhelming, but use that as just a kind of a beginning introduction into using that book. If you do have any problems or questions, feel free to email me. Also, I would like everyone to maybe work on a cold or flu or a sore throat case. So, let's try that. So that's going to be part of your homework assignment. Let's talk a little bit about remedy preparation. All your homeopathic remedies are regulated by the FDA through the Homeopathic Pharmacopoeia of the United States. All these remedies have been proved, and once the provings have been conducted, then they become eligible to be included in the Homeopathic Pharmacopoeia of the United States. So all of the homeopathic remedies are thoroughly tested. The source of remedies are plants, animals, and minerals. Nosodes, which are disease products, and sarcodes, which are healthy tissue. And they are also from drugs and hormones and from imponderables, such as X-ray, magnetic polis, australis, which is the South Pole. So we also have homeopathic remedies for sunlight, for the moon. So we're dealing with subtle energies. So all of these remedies, they're not just flights of fancy. They've actually been tested in some manner and proven. And this is aphorism number 267 from the book, The Organon. And that's probably the fourth book that you should probably consider buying. You have J. Yasker's Homeopathic Dictionary, you have Borky, and you have Kent's Repertory. The Organon is kind of like the Bible of homeopathy, and everything you want to know about homeopathy is in the Organon, but it's a very difficult book to read. And aphorism 267 talks about securing the healing power of plants. And they actually give a specific method. They press the juice of the plant, mix it without delay with an equal volume of wine, spirit, or alcohol. Let this mixture stand for 24 hours, then decant the liquid and store it for medicinal preparation. Keep it away from sunlight. And the medicinal value of the plant is thus preserved. And this is called the mother tincture. And all of our mother tinctures, herbal tinctures, are made in this manner. But that's not the homeopathic remedy. There are other steps that have to be taken. Now, when you have a solid material, like, for example, metal or gold, you can't dissolve that in alcohol. And it's called trituration. And trituration is when you mix the substance with milk sugar, and you triturate it by grinding it with a porcelain pestle until you mix the milk sugar with the material substance. And you keep on successively diluting this titrate with more and more milk sugar until you get kind of like the final titration, which is unsuitable to dissolve. Now, the skills of dilution are with the titration. Once it's diluted 3 times, the dilution factor is 1 to 1 million. it's now soluble in alcohol because essentially the uh, the healing substance of the mineral or the non-dissolvable substance becomes impregnated in the milk sugar. And it's now then, so you can even take poisonous substances, and by diminishing the strength or making them weaker, it reduces the risks and toxicological side effects. So in homeopathy, we have various scales of dilution. There's the X dilution, which is 1 to 10. And 1 part is the mother tincture, and 9 parts are the diluting substance. So, for example, that mother tincture that we took, we would then divide that tenfold. So we would take 1 part of the mother tincture, that plant that we soaked in alcohol, mix it with 10 parts, and that would become a 1X. If you would further dilute it by 1 to 10, then it would become a 2X, and so forth. A C potency or a centesimal potency is a 1 to 100 dilution. So if you take out 1 part of that plant tincture and you mix it to 100 parts of water, that becomes a 1C. If you dilute it again by 100-fold, that becomes a 2C. An M is a 1 to 1,000 dilution. CM is a 100,000 dilution. An MM is a 1,000 dilution. And an LM is a 1 to 50,000 dilution. So most of our work is going to be done with the C potency, a 30C. And a 30C is a solution that is made by diluting it 100-fold and diluting it again 100-fold. That would be 2 times. And you essentially do it 3 times, or not 3 times, 30 times to get to a 30C. Debbie, did you have a question? I'm unmuting you. I'm trying to. Okay, you're unmuted now, Debbie. Did you have a
The
question?
opposite.
I'm sorry, I didn't hear the question.
My hand shows down on my computer.
I don't
My
know.
hand shows down on my computer. I don't know why it shows up.
Click it again.
Okay.
No, your hand
It
is.
just keeps showing opposite than you have.
No,
Okay,
no, wait. Now
Now it shows up.
Now it shows down. I don't see anything. So you're gonna have to do the
Hello?
opposite. I don't know what's wrong with your computer. Now there's no hand on my computer. Okay.
Mine shows up now, and I have a brand new computer. There's nothing wrong with my computer.
Okay. Right now, there's no hand. So.
My hand shows up. That's probably why you're not seeing my questions. It seems to be opposite.
Yeah. Okay. Well, then maybe if I don't answer you, then just type a question. Okay.
Okay. That's what I've been doing.
Okay. So now that's the scales of dilution. Usually, when you go to the higher dilutions, the C, the M, the homeopathic remedy becomes much stronger, which is counterintuitive. Normally, we think of things when they're more dilute, they're weaker. But in homeopathy, we're talking about energy. So the 30C that I'm recommending for the class and for you folks is kind of a good, safe remedy. When you go to the health food store and they sell homeopathic remedies, usually they're in X potencies or they go as high as a 30C. Many homeopathic pharmacies will not sell a homeopathic remedy above a 200C unless you're a licensed physician or practitioner. It's felt that the 200C is should only be used by professional. The same with the M and the CM. Now, those of you that had chemistry, you may remember Avogadro's number. 6.02 times 10 to the 23, not 1023, 10 to the 23. That's the number of molecules in 1 mole. And when you dilute a substance, you're getting less and less molecules. And finally, you get a dilution where there are no more molecules. So essentially, at a 12C or a 24X, it's diluted to a point where there's no more physical substance. So what this means is that when we're dealing with toxic material, like for example, arsenicum album, arsenic is a homeopathic remedy. You know, some people will freak out, doctor, you're giving me arsenic. Isn't that a poison? Well, when you're given it at a 30C, there's no physical substance there. It's just the energy. So theoretically, some of these substances could be poisonous in the X potencies, but most homeopathic pharmacies do not sell poisonous substance in the X potency or a 1 to 10 dilution. Succussion is the violent shaking of the substance to release the energy. So when we're making these homeopathic remedies, succussion does take place. Most pharmacies use 20 succussions for each step for the X and C potencies. 2 years ago, I made my own homeopathic echinacea. I had some echinacea growing in my backyard. I harvested it, put it in equal parts of alcohol. I let it soak for 3 days. I decanted it, and that became the mother tincture of echinacea. And then what I did is I diluted it um, tenfold, succussed it 20 times, then diluted it again tenfold, and I made a 10x potency, which I used. So if you are interested in making your own homeopathic remedies, it can be done. The LM potencies are made using 100 succussions per potency. And the effect of the succussion, as I mentioned, is to liberate the healing potential of the medicine. So poisonous substances and low potencies of 1X are not available to the general public. Once you get to 3C or 6X, it's generally safe, even for poisonous substance. So that's important to keep in mind when you're prescribing these remedies. So how does a 12X remedy compare to a 6C? The dilution factor is the same. A 12X is 1 to 20, and a 6C is 1 to 200, six times. The succussion is different. So a 12X will be 240 succussions, and a 6C will be 120 succussions. So the potency of the remedy has to do with the succussions. Then the 12X is slightly more potent than the 6C. So this may be a little confusing, and it was confusing to me when I first heard this. Basically, there are 2 aspects of making a homeopathic remedy: the dilution and the succussion. The more dilute a substance becomes, the stronger, and also the more succussions. So when you're comparing the potency between a 12X and a 6C, the succussions probably have more to do with it than the actual dilution, since the dilution factor is the same in this case. Okay, I don't know if Julio, did you have a question? Julio, did you have a question, or are you just stretching? Julio, do you hear me? Hello? For some reason, I can't hear you. Julio, if you do have a question, if you wanted to. write it. Okay, LMs are made from triturations. And for example, some people feel that, like for example, pulsatilla is a plant, and we can make a centesimal potency from pulsatilla or an X potency. If we make a centesimal potency from pulsatilla, the plant is soaked in alcohol, and then that becomes the mother tincture. When we make an LM from pulsatilla, it's triturated. That means that the whole plant is mixed with um, the sugar and triturated. So we actually get more of the plant, more of the substance. So the LMs are diluted 1 to 50,000 3 times with 100 succussions each. So there's more succussions in the LM. And this is one of the methods that I'm practicing my constitutional homeopathy. I'm using the LMs. I feel the LMs are the strongest form of a homeopathic preparation. And we'll be talking about this later on in the course. Now, you can imagine that sometimes in making a homeopathic remedy, especially if you're going up to a large dilution, it requires a lot of succussion or shaking. So there's two types of the machine. There's a Hahnemannian and a Korsakoff. The Hahnemannian machine uses separate valves for each dilution. The Korsakoff, the same valve is used. So it's kind of an automatic machine, and it's really amazing to see this machine. It's like a robot, and the droppers are automatically put in. It's shaken and poured, and it's done automatically. Some people feel that hand succussion is the best way to make a remedy because you're putting your body's energy into making the remedy. So there's different schools of thoughts, and when you're buying homeopathic remedies, you'll be told whether it's Hahnemannian or a Korsakoff. And I believe that the remedies that you have are Hahnemannian remedies, not Korsakoff. Well, the remedies you bought with your home remedy kit. Let's talk a little bit about case taking. It's a habit among beginning homeopathic practitioners to rush into taking a case. You learn a couple of remedies. I can remember my first week at homeopathic college, and we learned 3 remedies, and I thought, wow, homeopathy is easy. I just categorized them into one to 3 remedies. But the more you study homeopathy, the more you realize that case taking is an art, and a case well taken is a case half cured. If you don't take a good case and you don't go over all the symptoms, you don't have a chance. You have to find out as much as you can about the person, who they are, and the way they exist in the world. And one of the most important things is, what are the limitations of freedom? What is the particular problem? How is it limiting them? And that can be helpful even in an acute case. So, if someone develops a sore throat and they become bedridden and they're limited, you want to find out how that sore throat is affecting them. That becomes part of the homeopathic case. So in other words, maybe they're upset because they can't play their music, or they're unable to work, or they're unable to communicate. So there's something behind every illness. So in the case taking, we have different kinds of cases. Well, the first aid is what happened when. due to stress, trauma, or injury, much like the Leadham case, stepping on a sharp object. An acute case is a crisis of severe symptoms. It's usually self-limiting, has a beginning, middle, and an end. Speeds recovery and reduces the risk of complications and the degree of suffering. So mainly we're going to be dealing with acute situations. Typically, an acute situation like the sore throat will get better by itself. It may take longer without homeopathic remedies, and but the risk is not as great as taking a constitutional case. A constitutional case is a chronic condition, and this is something that a professional homeopath will do. A professional homeopath needs to look at the timeline of the person, their life, all of their health issues, and it's a very involved and sometimes undaunting procedure to take a constitutional case. Acute cases, what part of this course is a much simpler way of beginning homeopathy to understand the mechanisms of homeopathy. So we're going to be focused on acute prescribing, acute first aid, which is a good introductory way. Now, an area where you can get into trouble, many times a chronic problem will have frequent acute manifestations or diseases. Like, for example, a person who gets pneumonia every year. It's more than an acute. There's an inherent constitutional weakness. So yes, you can treat the acute with somewhat success, but the real cure isn't going to occur when you treat the underlying problem, which is causing the pneumonia. Same thing with an individual that maybe gets a herpes outbreak every spring. It's more than an acute problem. It's some inherent weakness that is leading their body to develop this herpes infection. So whenever you're taking an acute case, kind of inquire, and I think this is important, inquire to find out, has this situation happened before? And if it's frequently a frequent occurrence, then may be more of a constitutional or general problem than an acute. In the book, The Organon, in aphorism 83, Hahnemann states, case taking is a process that demands a physician freedom from prejudice on senses, attentive observation, and faithfulness in recording the disease. And the problem is in homeopathy, you lose this freedom from prejudice. Like, for example, the puncture wound case. It may have made an impression with some of you, and in your mind, you're thinking that all punctures are treated with leadum. That may not be the case. There may be another presentation of a puncture wound that will need a different homeopathic remedy. You really have to be objective and free from prejudice when you go in and you're analyzing your case. You have to be attentive in your observation and record all of the details and study them to select the whole remedy, the right remedy. The simillimum, that's going to make a difference. There may be many homeopathic remedies that will help somewhat, but when you select that simillimum, the one that matches the case precisely, that's when you're going to see miracles in homeopathy. Okay, so part of the case taking is the etiology, what was going on at the time. Exposed to dry, cold air, you think of aconite, grief, ignatia, trauma, and insulting event, Staphylos aureus. So there's certain remedies that are more prominent depending on the etiology. Arnica for an injury. Thyme, When is it better or worse? Better during the day, worse at night, etc. Location, left, right, which part of the head? We already talked about how important it is, especially for a sore throat. Pharyngitis, is it left or right sided? Sensation, what is the quality of the pain or discomfort? Radiation extension, does it go anywhere? Intensity. Concomitants, anything else happening at the same time. So if you have a sore throat and a headache, that's a concomitant. You have diarrhea and a headache, that's a concomitant. Alternating symptoms, are the symptoms changing from one organ to another? Chest pain, then abdominal pain, then back pain. Amelioration or aggravation, what makes it better or worse? So this is kind of your guideline. And when you get the PDF of these slides, you may want to put this on a little index card. So when you are taking a case, trying to figure out the homeopathic remedy, you'll put some notes down for each one of these. And the suggestion was made by one of you that I send you a copy of all the slides prior to the next webinar, and I'm going to do that. So before lesson number 3, you'll have all these slides, so it's not going to be necessary for you to take a lot of copious notes. Yep. So you are going to get, Debbie said the question, you are going to get all these papers before class so you can make notes. So you'll have that. All right. So keys to case taking. The essence, totality, and the keynotes. And we'll talk about each one of these, which are essential aspects to understanding the case. And you usually don't figure out the remedy while taking the case. When you sit down and start doing some reading and studying, that's when you figure it out. Keynotes are a single point of data that indicate a particular remedy, strange, rare, and peculiar symptoms. One of them we talked about today was the craving for lemons with belladonna, and the red triangular tip to the tongue with Russ Talks, and the lachesis sore throat, which is better eating solids than warm water. So all these are strange, rare, and peculiar. And when you're studying a homeopathic remedy, these are usually the things that stick in your mind because they are strange, rare, and peculiar. And this is what really is helpful in finding the right remedy. The totality is the total sum of all the symptoms that the person has: the physical, emotional, mental, and spiritual. Whenever you're taking a case, I like to describe it as 3 legs of a stool. You like to have a good physical symptom, a good mental, and maybe a good emotional or general. So when you have 3 good symptoms that match a remedy, a 3-legged stool is sturdy. It doesn't wobble. You have your totality. The chief complaint in case taking is what their main problem is. And of course, the chief complaint may not be what you think it is. So, why are they coming in? You have to ask them, what is the main problem? Why are you here? Modalities are things that modify the chief complaint. So if they come in with a sore throat, that's the chief complaint. Modalities, what makes it better? What makes them worse? Hopefully they'll volunteer some information. If they don't, then based on your knowledge of materia medica, you will ask them specific questions. So like, for example, the sore throat, first thing you're going to ask them is, what side is it worse on? Is it right, left, or no difference? With the cough, what are you going to ask them? Is it a wet cough or a dry cough? That's the starting point. And then you begin to narrow down the remedies. Also, causation. Um, what were you doing when you developed the sore throat or the cough? What was the environment? What was the situation? Were you exposed to dry, cold air? Was there a shock or a grief? Were you overworking, etc.? All these factors. So areas to explore: the mental emotional state, fears, habits, um, anxieties. What were they wearing at the time? Bathing suit, heavy winter coat. Um, uh, their childhood issues. Um, what was their health like as a child? Relationships, stresses in relationships, their sexuality, sleep. How are they sleeping at night? Dreams, perspiration, foods, aggravations or cravings, aversions, etc. So, of course, a lot of these are not applicable to most um, acute case taking, but sometimes when you don't have success with prescribing for an acute case, you want to sort of explore some of these areas to get something peculiar or interesting or odd. Then you can use that to further narrow down your remedy, to get a much better remedy. We're going to talk about the type of symptoms. There's common symptoms, peculiar symptoms, general and mental symptoms. And all of these symptoms have a different hierarchy in terms of their level of value when you're taking a case. So the general symptoms or generalities are symptoms that reflect all levels of a person. In acute case taking, it is to find out which general symptoms have changed with the illness. So by a general symptom is something like, I am a chilly person. I don't like hot weather. I have a lot of energy. I am sensitive. So it's not like my arm is cold or my head hurts. It's generally what their whole body is like, you know. Um, I am a sympathetic person. I am irritable. I don't like this. So it's a general symptom. So um, we want to know what has changed with those general symptoms. So if someone, I am always a hot person, but since this accident, now I'm chilly. My goodness, that's a major homeopathic remedy. That's a major homeopathic shift. I never liked lemons, but now since I have my fever, I have a craving for lemons. Wow, that's a big, big homeopathic symptom. And, that belladonna should pop in your head. They have a fever, now they're craving lemons, and they never did before. So the generalities are important to look at, and especially determining changes in the generality. mental symptoms with the person. Listen to what is being said and what is not being said. As a homeopathic practitioner, you have to be comfortable with silence. You want to get them to talk. You want to look at their body. You want to look at their emotional discomfort. You want to monitor your own feelings when you're talking with them. Because most people want to please you as a homeopathic practitioner, as a doctor, they want to please you. Sometimes when you detect a certain area of discomfort with them, that's where the most important information can be found, is that area of discomfort. Contradictory things are important, and changes in mental symptoms. So if they have developed the flu and they're more irritable, more angry, they have grief. I can't emphasize how important the mental state is in really localizing a homeopathic remedy. Sometimes that can be the differential point. For example, we were talking about cold and flu remedies, and chamomilla is a remedy, but they tend to be irritable, capricious, while phosphorus can have the exact same symptoms, but the phosphorus tends to be sympathetic, trying to please. Compared to pulsatilla, pulsatilla tends to be a weepy remedy. They cry easily. So really the mental symptoms are key. The essence is a central concept to the person. That is a theme that travels through the entire individual. And these symptoms spring from like a central core of a person. For example, the remedy Illumina, which we haven't talked about Illumina, is that they tend to be constipated on all levels: physical, mental, and this emotional constipation, this dryness. Pulsatilla, tends to have this weepy or wet essence that goes through everything. So they cry easily when they get the cold or flu. They get a discharge when they have diarrhea or something like that. It's like this weepy, this wet. So when you study these homeopathic remedies, you're going to find a certain essence that goes through, and sometimes this essence is very hard, to comprehend or understand. And many times this essence is difficult to explain or to put into words. It's kind of a feeling or a sensation you have when you study homeopathic remedies. We talked about Russ Tox. Russ Tox is a cold and flu remedy. Remember, the Russ Tox person has this stiffness. They are better with motion. And not only do they have this like physical stiffness, they tend to be stiff and it's harder for them to get moving. They also have a mental stiffness. In other words, when you're talking to them and when they're thinking, they start out slow. It's like a door hinge in their mind, where this stiffness has to be overcome and then the thoughts begin to flow. So every homeopathic remedy has this unique essence. So observation, wonder, and perception. Observe well the physical, the way they move, the tone of their voice, Homeopathy, you're trying to understand that person on a different level than we're used of comprehending. And this is something that is an art, and you have to open up your senses of observation, and that's what makes homeopathy really wonderful. So even when you're taking an acute case, you're trying to perceive that individual on a different level. You're trying to determine their vibration. What is their vibration um, that is causing them to have this illness or malady? So the perception of combining the wonder with the observation, a living image of the person matched with the image of the remedy or their essence. A lot depends in homeopathy on the strength of the vital force, a reflection of the vitality of the person. And this helps to determine what potency to use and the prognosis. The vital force depends on age, hereditary, level of stress, sensitivity, suppression, and freedom. Typically, a person with a strong vital force will respond much better to a homeopathic remedy. That's why children and young individuals and animals react well to homeopathy. If you're up in your years, your body has been suppressed with petrochemicals, antibiotics, vaccines, and GMO foods and poor diet, it's going to be harder for a homeopathic remedy to work. I'm not saying it's not going to work, but it's going to be more difficult. The center of gravity uh, is where the disease is. So the center of gravity in the physical has a much better chance of working than center of gravity in the mental. Mental illness is probably the most difficult thing to treat homeopathically. A simple physical problem with a strong mind and strong emotions, the homeopathic remedy will work much better. You have to determine where the center of gravity is. Obviously, someone with a sore throat and good emotional health and good mental health is going to respond better to a remedy than someone who has a sore throat with schizophrenia and mental and emotional disturbance. We talked a little bit about evaluating each symptom when you're taking a case. So when you're writing down your notes, it's important to underline bold, italic, or plain. The bold is the number 3. You can either put it in bold letters or write number 3 besides it. The italic is number 2. The plain or number 1 is a lower level symptom. So typically, the chief complaint is bold. Uh, Something that the patient or person volunteers to you as a symptom is bold. But when you begin to inquire or you have to probe and they're not sure, then obviously that's plain. But when I see something bold, that means that it's really strong. The person volunteered it and it's a strong symptom. And this is an important way to mark the symptoms. So then when you go to repertize or look for a remedy or reading in Borghi, you'll know because in Kent's, when you look up a symptom, they will grade the symptom according to a certain level. It'll be written bold in the book, italic, or plain. Bold is something that is very prominent. These are strong remedies. So typically, if the patient has a bold or a number 3, and you're looking in Kent, you want to also look for a bold symptom. So I hope that makes sense. And when we're reviewing the repertory, we're going to go over that again. Sometimes in children, you're not going to get much of a case because they're not communicating with you. So you can watch how they play, watch how they interact, and interview the parents. In very closed patients that are not relating symptoms, Dreams. Wait, just 1 second. 1 second, please. He's to put it. He's not to put that by there. He's to put it by the saw. Not there, honey. By the saw. Sorry about that. Also, dreams and sometimes fears. Always ask. Let's say you would get a fever and you're having a peculiar dream. You want to document it. Anxieties. You want to document that. And see, especially changes in those things. So provings, I'm going to talk about provings now. Provings are the way we learn about what a remedy does. And all of our homeopathic remedies have been proven, and we'll talk about provings in a little bit more detail. Also, toxicology symptoms. So if you ever read a chemical book or a chemical index of toxicology, substances will have a toxicology list. So these are in a way proving symptoms. In homeopathy, there's no such thing as a side effects. It's a way a remedy reacts. So, for example, if a certain high blood pressure pill causes depression, that's a toxicology symptom. It's a proving symptom. It's not a side effect. Also, in the homeopathic literature, we looked for cured cases. So when a homeopathic remedy cures a disease, that becomes a number 3. That moves it up in terms of the ranking. And we're also look at families of remedies. These are remedies that have a similar vein. So, like for example, myself, when I took a homeopathic remedy that cured my asthma, this remedy was ranked very high for asthma in Kent's repertory, and it had a profound effect on me. If that remedy had a low ranking, then that would have been maybe moved up after a cured case. So the way provings are done, a supervised administration of a substance is given to healthy people in order to produce the symptoms that are specific for that substance. So in other words, let's say all of you, we were going to do a proving. And I'm assuming that all of you are healthy and you're not having any symptoms. So I would give you an unknown homeopathic remedy. It'd be white pellets. And I would say, okay, class, I want you to start taking these white pellets and keep a journal and record all of your symptoms. And after you would take these pellets, you would maybe note some of you would get a headache, some may get back pain, some depressed, etc. There'd be pages and pages of symptoms that you would record. And then we would then go over all of these symptoms. And let's say everybody in the group got a severe headache. That would be listed as a 3 or a bold. Let's say maybe 1 or 2 of you got some cramping in your foot. That would be a number 1. And maybe if half the people got a certain symptoms, that would be a number 2 or an italic. So that's how provings are done, and that's how homeopathic remedies are evaluated. And let's see, we have, I have a question here. Veronica, I'm trying to unblock you. If you do have a question, maybe you could type it, because I'm not able to unmute you. Oh, let's see. Okay. Okay, so provings introduce a foreign substance into the organism or person to disturb the organism, to mobilize its defense mechanisms to produce a spectrum of symptoms on all levels: physical, emotional, mental, and spiritual. Um, so we have some people, provers, that are very, very sensitive, and they make the best provers. Um, and in homeopathic studies, I've been involved in a couple of provings through my homeopathic training, and they're just really remarkable. You know, you're given a substance and you record your symptoms and you get together with the class and you kind of identify all the prominent symptoms. And then it's really a shock at the end to then determine what the remedy was. And I can remember we did a proving of the yellow pond lily. And there were homeopathic doctors from all over the country. And we were sent the yellow pond lily. And very, very peculiar. We met at a hotel in Boston to review this. And it was like so bizarre because, you know, when you do a proving, you unleash the spiritual energy of that substance. And we met at a hotel in Boston, and we didn't know what the remedy was. But when we walked into the hotel, there was a beautiful pond with yellow pond lilies. And that weekend in Boston, they had an exhibit of Monet's pond lily paintings. So, you know, whether or not us taking that homeopathic remedy caused a shift, we don't know. But then we got together and then we recorded all of the symptoms and came up with the whole remedy picture of the pond lily. Hahnemann was the first one to do a proving, and this was the remedy China. And Hahnemann did over 100 provings by the time of his death. They were mostly plants, and they were written in a book called Materia Medica Pura. Constantine Herring did animal provings, and at that time there were all provers unions. There were people that actually paid to do provings. They were individuals that were sensitive. So provings are the way that we determine the actual symptoms of our remedies. So why do provings? They elicit the symptoms of the medicinal substance, and it's done in a very, very scientific way. And I think the provings are much more extensive than traditional big pharma studies. It also widens the homeopathic pharmacopoeia. We're constantly getting new homeopathic remedies. It also meets FDA drug requirements, and it's a way to learn about our natural world and substances that are out there that can help us. So, to participate, you must be healthy, free from chronic disease, not under a great deal of stress, between 18 and 65 years of age, able to record daily in a journal, and you have a pre and post op recording. Exclusions: if you have prescription drugs within the last 6 months, surgical procedures, high potency remedies, pregnant nursing women, dietary, medical treatment, etc. Unable to give up coffee because it's felt that coffee will antidote some homeopathic remedies. Unable to give up recreational drugs. So the provings are set up in a quiet, clean environment. Length of proving varies. Get a baseline of symptoms. Um, and this is one of the reasons why we do a pre-proving interview. The more personnel, the better. We have a proving director, proving supervisor, sponsors, and provers. So it's a big undertaking. And usually it's blinded. In other words, some of you will get an active ingredient. Some will get a controlled substance. The potencies varied. And typically you're advised to stop the remedy when you do get a symptom, especially a severe symptom. You record symptoms that are departure from your usual state, dreams. You also discuss with a family or a spouse member changes in your personality. And then at the end of the proving, we have an exit group meeting where people discuss changes that took place in them. And sometimes these meetings bring out symptoms that others may have had but not have recorded because they felt it wasn't significant. Let's say that I got a little wart on my toe. I didn't think that was significant, and I heard 5 other people in the group get warts, and I go, "Oh yeah, I got a wart too." So that becomes part of the remedy. So the proving data, we talk about intensity of the symptoms. Is it a mild headache, severe headache? What happened first after taking the remedy? The frequency, modalities, which makes it better, what makes it worse, strange, rare, and peculiar, and themes. So then we create a homeopathic remedy that becomes a new addition to our materia medica. Sometimes in the provings, individuals will develop no change, mild symptoms, or cured symptoms. I've been involved in some provings where individuals had chronic problems that were cured during the proving. So that obviously becomes a strong point in the materia medica in Kent's repertory. Well, there are ongoing provings right now. There's new substances in our culture. We know of substances for their healing properties. Certain animals are becoming extinct. So all of these things need to be proven. Let's see. So anyway, if any of you are interested in becoming part of a proving done at the American College of Homeopathy, you're welcome to contact the college. Contact Marilyn at 480-383-9586, and you can become part of the proving. I would recommend that all of you take part in a proving and to really learn and understand the subtleties of homeopathy. Veronica had a question about the mental and emotional dryness. How does it show itself? Well, a mental dryness, I guess dry wit, dry humor. There's no juiciness. I guess maybe like an engineering personality, very dry and serious. So that's the example that I was talking about. Alumina, the dryness is throughout the whole body. Constipation, dry skin, dry emotions, dry thinking. And of course, alumina is a really big remedy for the treatment of Alzheimer's disease and Parkinson's. And also, one of in toxicology studies, high alumina levels cause Alzheimer's disease. So it's interesting that alumina in our homeopathic literature is a remedy, for Alzheimer's disease based on toxicology study. So The Organon is a book written by Samuel Hahnemann. It's probably the most important homeopathic book ever written. There were 6 editions and changes by his death. The first edition was published in 1810. The last one was rediscovered in 1921 by William Boricke. Most homeopathic doctors practice the 5th edition of the Organon, and more recently there's interest in the 6th edition, and the 6th edition deals more with LM potencies. Organon means an instrument of thought or knowledge, a set of principles used for scientific or philosophical investigation. And the Organon is a creative core of true healing. It's timeless. I think homeopathy stands by the pillars of truth, universal law, forms the basis of homeopathy, and each reading reveals new gems. And it's recommended by homeopaths to read it twice a year for the first 50 years of practice, and then after that, once a year. And most homeopathic doctors, including myself, who take homeopathy seriously, I try to read the Organon every year. And so that's, as I mentioned, that's one of the books that I think that you should obtain, the Organon, and read it and digest it. It's divided into 291 aphorisms. Each one is a separate paragraph about health and disease. Wynda Brewster O'Reilly writes, the Organon is a remedy of the highest potency. Like other great works of art, it constantly reveals new marvels and mysteries, acting dynamically in relation to each reader and acting differently with each reading. And Wendy Brewster O'Reilly has an excellent edition of the Organon that she translated and wrote comments. And I think that that might be a good introductory book. It's divided into different sections. Aphorisms 1 through 71 are the principles of cures. The next group is understanding disease, taking the case, acquiring the knowledge of medicine, homeopathic treatment, the chronic miasms, mental and emotional disease, intermittent disease, case management, etc. The first three aphorisms are the most well-known and are the foundation of homeopathy. Okay, what I think I'm going to do is let's take a 15-minute break. And then when I come back, we're going to go over some cases. And it's going to be fun. I'll read the case and I'll just go over how I came up with a remedy. So this will be a good example of you to review all the materia medica that you have studied. So we're going to be back in 15 minutes, okay?